Hello, my name is Emma Romy. Today I'm going to be doing my tracheostomy care skill video today. I'm going to be practicing general principles and safety practices. First thing I'm going to do is identify myself, explain the procedure to the patient, and I'm going to identify them with 2 patient identifiers and assess for any allergies, specifically latex because of the gloves we're using. Now I'm going to assess my patient for pain. I'm going to perform a pain assessment. I'm going to ask them, are you having any pain today? They said no, but if they did, I would ask them to rate it 1 to 10, and I'm going to let them know during the procedure if they do have any pain. They can let me know by putting their fist up. And now I'm going to make sure my patient is appropriately positioned, so semi-Fowlers or side-lying lateral. They are in semi-Fowlers. So now I'm going to perform hand hygiene and set up my waterproof pad on my patient just in case. And put on my face shield. Right now that I've done that, I am going to perform hand hygiene and open up my sterile supplies. So I'm going to open up my cannula first. And then my trach care kit. I'm going to open up my sterile saline and pour it into the empty part of the box so we can use that for cleaning. Now I'm going to perform hand hygiene and don my clean gloves. We're going to be removing our dressing and cannula. So I'm going to make sure I stabilize our faceplate while removing our cannula. I'm going to dispose of that. Now we're going to remove our slide dressing while stabilizing our faceplate. Dispose of that. Now I'm going to remove my gloves and perform hand hygiene. I'm going to go directly back without letting my sterile field leave my site and put on my sterile gloves. Make sure they're unopened, not expired, clean. Alright, now that we have our sterile gloves on, I'm going to come back upon my sterile field. And the first thing I'm going to do is put in my sterile cannula. So I'm going to stabilize my faceplate. Grab my cannula. And put it in. Now that we have our cannula in, I'm going to clean around the stoma. So I'm going to get my swab, dip it in sterile saline, and clean under the faceplate where the stoma is, and use a new swab with each swipe. Alright, now that that's clean, I am going to dry it with sterile gauze, stabilizing that faceplate. Alright, now that we have it dried, I'm going to apply our new dressing, stabilizing the faceplate. Not touching our trach. Keeping that faceplate stabilized. Alright, now that we have our dressing applied, I'm going to change our trach collar using the 1-person technique. There's also a 2-person technique. I'm going to be using the 1-person We have to put the collar on fully before we remove the old one.
No, it'd be needle, like, it depends on if they can take medicines, like, do they take them whole, or, like, how do they take their medicines? IV, then yeah, it'd be IV. Because if they take certain medications whole, it'd be that one. If they take them, like, in a needle, for instance, like a syringe or something, and it's that way, you know?
Yeah. It's an antibiotics. How long for another?
You say that allergy info.
Yeah, I saved it after this.
Okay, let me see.
Alright, now that we have the new one fully on, we can remove our old one.
Alright, there's two of them saved. I don't know how to get rid of them, but whatever. And then I think all you have to do, one is
Just erase that and put it on.
yeah.
Now that we have our old collar off, we're going to check the fitting of the collar, making sure we can put one finger through and that they still have mobility in their neck. And now that I have done their care and put the new collar on, I'm just going to make sure they are okay and comfortable. I'm also going to document and record this whole procedure and perform hand hygiene. Thank you.